Remember to subscribe and hit the bell icon to never miss an update from Dr. Mike Baby Care Channel.
Your pregnancy. Week 22. Welcome to week 22 of your pregnancy. This is a good week to love your bump. Talk to it, sing to it, caress it with moisturizer, and you might even feel a little flutter in response. It's all part of bonding with your unborn baby who, as you can probably tell, is getting bigger and bigger by the day. Your baby's development at 22 weeks. At 22 weeks, your baby is about the size of a papaya. Though baby's eyelids are still sealed shut, your little one can perceive light and dark now. Shine a flashlight on your tummy and see if your cutie pie moves. Tear ducts are also forming and your baby now has eyebrows, little tufts of fine white hair. He may be furrowing those tiny brows. Baby's ears are beginning to hear and process sounds from inside your body, your breathing, your rumbling tummy, and your heartbeat. Your baby's brain is rapidly developing and nerve endings are forming. By about now your baby has developed a sense of touch, which means he might be experimenting with this new sense by stroking a body part that he happens to reach or sucking his thumb. 22 weeks pregnant symptoms. Acne. Increased oil production may cause you to develop acne. Stretch marks. You may start to notice stretch marks on your abdomen as it expands to accommodate your growing baby. These small streaks of differently textured skin can range from pink to dark brown, depending on your skin color. Although they most commonly appear on your tummy, stretch marks may also show up on your buttocks, thighs, hips, and breasts. What's not so cool is that the stretch marks may never go away completely, but they will fade in color after delivery, so they'll be much less noticeable. During the second trimester, you may also be experiencing leg cramps, forgetfulness, food cravings, nasal congestion, back pain, and heartburn. There's a new symptom that you may begin to feel this week, which is the tightening of the uterus. Uterine contractions. Your uterus is contracting, but you might not notice it. Braxton Hicks contractions begin as early as 20 weeks, and they become more common as pregnancy progresses. Braxton Hicks contractions are often considered practice contractions. They aren't dangerous. However, it's important to know the difference between these practice contractions and the real thing. Number 1. Braxton Hicks contractions are irregular while labor contractions are more predictable in their pattern. Real labor pains get stronger and more frequent over time. Number 2. Braxton Hicks contractions are not accompanied by other symptoms, while labor contractions may be joined by back pain, vaginal bleeding, or a gush of fluid. Number 3. Braxton Hicks contractions tend to go away with movement or exercise, but true labor continues. Pregnancy checklist at 22 weeks pregnant. Start or continue doing Kegel exercises. Continue to take your prenatal vitamins and choose healthy foods. Start to think about who you would like to be with you during labor and delivery. Research for doula. Look into newborn care classes. Find a maternity photographer. Now that you're 22 weeks pregnant, your belly will be expanding so much that you might start to get some stretch marks and you might even have a newfound outie belly button. While you might not love all these side effects, you'll probably want to capture your pregnant belly in some professional photos. 22 weeks is a good time to start planning for a maternity portrait session. Thank you for watching. Don't forget to subscribe.